Today, let's talk about erotomania disorder. These people, in their delusional state, believes that someone of a higher status is in love with them. And this stems from the subtle actions or signs that these people show to them. And they make them believe in their delusional state that they are communicating their love towards them. They feel that once they see a celebrity or someone of a higher status in their community or wherever they find themselves, it can be their bosses at work, showing signs of care, a bit of affection towards them. They have this delusional belief that the person is communicating his or her love towards them. And by so doing, they are also in love with the person, or the both of them are in love with each other. Despite clear evidence showing that the opposite is the truth. The exact cause of this condition is not really known, but it is believed schizophrenia or bipolar plays a role in this condition. We also have environmental factors, loneliness, childhood traumas, depending on the environment the person was raised, conflict environments where the child grows up or the person is always experiencing fights here and there, arguments here and there, and it's looking for a safe space or a safe haven. Low self-esteem. A lot of things causes low self-esteem. As I said, in a conflict environment, the person grows up not having that kind of environment that probably he or she thinks that everyone is having. So he looks down on himself, he looks down on herself, and then begin to think that the other person or the opposite sex is the one supposed to give him that kind of love and safe haven he's looking for. To talk of the person being of a higher status, it's like a big deal for the person. Online romance field. Most of the times, celebrities post things on their social. Some people comment not because they want to comment, not because the person is really beautiful, and some people are actually really crashing and are being delusional about it. Neurological conditions such as brain tumors, stroke, and then head traumas can all trigger this condition. Families that are having dementia in it, or families with psychiatric disorders, all triggers this particular disorder. People who are addictive of alcohol, drug use, they all contribute. These substance abuse triggers a lot of disorders. There's also defense or coping mechanism when people are lonely and they are trying to run away from this loneliness, or they are trying to avoid the loneliness. They try to look for replacements. They look for things that's like a safer place and an easier way out. Social media can cause a lot of things, and erotomania disorder is one of them. So it is important to be cautious of how you respond to social media messages. That is, if you are of a higher status, or if you are in a position where you think that you do not want to trigger any online romance, it is better to avoid and be careful with some of the replies that goes to your fans. Looking at some of the symptoms, they begin to stalk you. So they can be stalking you on social media and even bring it outside social media. So where you post that, oh, I'm here, I'm having a meeting here, you will see them there. Not sometimes, you may not even notice that they are stalking you. They are looking for people who quenches their low self-esteem, who will make them feel like they belong in the society. They misinterpret whatever signs, whatever actions that you are giving them. However you communicate with them, they misinterpret it for their own gains. And amidst all of this, they lack evidence. They don't even have the evidence proving that the person of a higher status or the person they are in love with is actually in love with them. They begin to have persistent attempts to contact this person at all cost. They will find so many ways to get through to this person. And in by so doing, they end up harassing the person. Because if you are persistent about getting into the person's DM, trying to find where the person lives, trying to get the person's number, try to always get in contact with this person, the person may see it as harassment. Actually, it is harassment. And in all of this, they are able to justify their rejection. You see, they justify the rejection to protect themselves, protect their secrets, because they are not ready to accept the realities of life. They are extremely jealous, possessive, aggressive towards this person. You know, they come with full force. They do it in such a way that you may see it and then you smile and be like, oh, that's how he is. He is just overprotective. No, they are delusional about their emotions towards you. So they will make the people around you uncomfortable to the extent that you will end up being uncomfortable. With some of the effects, they refuse to accept rejection or anything that contradicts their delusional belief towards the other person. The person doesn't even know them, or the person probably likes them. It's just, you are my colleague and I have to treat you as such. You are my subordinate and I have to treat you as such. I have to be nice in as much as I'm your boss. They are not ready to accept it, even when there are clear evidences presented to them, causing a heinous strain in their relationships towards friends, family, and loved ones. They create a lot of issues in their workplaces, individual workplaces. They can be in love with their bosses, creating a lot of issues, If you harass your colleague, if you are jealous, extremely jealous, aggressive, and possessive of your colleague or your boss, and then you end up stalking this person, getting into their messages, their contact, calling people you're not supposed to call to move away from them or stay away from them, you may end up having legal issues. So they go through a lot of financial difficulties because they will buy the nicest perfume to wear. They will do things that they believe will attract the other person to them. If you don't love me, I'll harm myself. If I can't have you, nobody will have you. So the tendencies of they harming themselves or the other person or the people around them who they think are a stumbling block to they getting access to these people is very high. They are always in distress. For treatment, medication and therapy. Therapy, you can look at CBT, which is cognitive behavioral therapy. This will help them modify their thoughts and delusional beliefs and also understand the realities of life. It will also help them modify their thought patterns and their social skills and coping mechanism so that they are able to live with these people without anything that violates the person's rights and freedom. Educating family members and loved ones is also helpful. In severe cases, they end up being hospitalized because that is the only way you can tame them. Risk management therapy is just to assess them and then help them manage their behaviors so not to cause a lot of harm for themselves and then the other person. And then we also have the social therapy, which is also, can also term it as group therapy. It helps them to have that feeling of not being alone, and then they have a feeling of belongingness, like they belong, they have a family that who can understand them and share a common interest with them. I wish you the very best. Thank you for watching this episode. Please don't forget to subscribe, like, and share for me. I'm grateful. Have a great day. Bye.